Thank you very much for that, Sarah. All the latest weather online, of course, at bbc.co.uk/weather. Now, I didn't know that I'd be saying this morning, but it seems some people are taking Pam Ayres too seriously.
I wish I looked after me teeth.
Because that's what they're doing. This might make you a bit squeamish, but 1 in 3 are pulling out their own teeth instead of going to the dentist.
Ew, that makes me feel funny, that does.
It's a recent survey by YouGov showing how many people are doing extractions and teeth whitening. The main reason being it's too expensive or we're too frightened. Something that's being explored on BBC One tonight in a programme called The Truth About Your Teeth. Angela from Cheshire is among those on the show when she's shown using methods to fix her loose teeth.
I use glue on the top of the tooth and then I put it back in place until the glue is set.
As you push it in?
Yeah, the glue, yeah.
It spreads?
It spreads.
It's just a normal super glue. It says it's an irritant. Something tells me this is not stuff that you should be putting in your mouth.
Yeah, the instructions. BBC Radio Stoke's John Akers has been to Style Dentists in Stafford.
Now, I used to be quite scared of the dentist due to a bit of a botched root canal the day before Christmas Eve one year, made me petrified of them, but I've kind of managed to find myself a good one. But plenty of people, after an experience like that, might not go back and are trying to do dentistry themselves. I know, it sounds a bit bonkers, doesn't it? So I've come to talk to Dr. Richard Howarth about it. Hi Richard. DIY dentistry. I couldn't believe it was happening, but it is. What are your thoughts on it?
My thoughts are that as an emergency procedure, it's probably a good idea. But the whole aim of sort of an emergency dental kit where you've perhaps lost a filling and you need to patch it up is for you to then go and see the dentist and get it sorted out. If you don't, the risks of infection and it continuing on, if the disease hasn't actually been dealt with and all you've done is patched it up, then that disease will continue underneath that temporary filling.
So what kind of things are people doing then?
Well, it can be as simple as they've gone into Boots or one of the other chemists and bought one of these very good temporary dental sort of kits which allow you to perhaps stick a crown back on temporarily or patch a tooth where fillings come out or cuspers come off. That's probably the better end of it. 2, people actually having a go at taking out their own teeth. And even filling their teeth with materials which were designed to be used in a different way, perhaps even body fillers for cars. The problem with materials which aren't tested for use in dentistry, and all the materials we use have to go through really rigorous testing, is they could be toxic. So you could be really putting yourself at risk by using something which hasn't been designed to be used in your mouth.
Have you come across any people doing DIY dentistry in and around Stafford and you've had to fix it?
Yeah, probably the most common thing I've seen is the use of super glue.
I can't get my head around it. So what's someone done?
I've had bridges stuck back together with super glue. I've had crowns re-cemented with super glue. I've had dentures stuck back together with super glue. So those are probably the most common thing that I would see on perhaps not a weekly basis, but certainly once a month, somebody being with a repair, a homemade repair.
And what kind of problems does that cause you?
Well, the worst I've seen is somebody with their mouth stuck together with the super glue. And that was when I was working in hospital and somebody actually physically stuck their mouth together with the super glue. And we had to sort that out as well. But most of the time, it's not designed to be used in that way. However, it's probably not that toxic. So in terms of safety, you could use it, but again, as a very short-term measure to get you out of trouble at the weekend. But I would honestly prefer you to come and see a dentist and get it sorted out properly first off.
Do people still pull their own teeth out? When I was younger, there was the whole string, door handle, close the door.
I've never actually had anybody come in and tell me that they've pulled out their own tooth, unless their tooth was about to fall out. Obviously, some people do get very bad gum disease, and they do get to a point where probably if they just had some pepper and sneezed, it'd fly out. So, there does get a point where if you've had really bad gum disease, they're going to come out very easily anyway.
Is there an underlying problem here that there is a poorer element of our society who perhaps aren't on benefits and can't get access to free NHS dentistry, that it is too expensive and they are struggling to actually pay for it?
I've always said that if somebody's not going to the dentist, it's one of three things. It's either fear, the economics, the money, or time. They just can't fit it into their daily lives. However, what I would say, though, is that the value that NHS dental care offers in this country is still fantastic. And if we look at what other people would pay in European countries for the same care, it's very, 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 very good value.
Richard, thanks ever so much. The programme is tonight. It's DIY Dentistry. You can have a look for yourself. It's on BBC Two tonight.
John Akers at Style Dentist in Stafford. I can't believe anyone listening to this show this morning has ever done any DIY dentistry like that, using body filler from a car to do your own teeth. Maybe you have. If you know someone who either couldn't afford or was terrified or just didn't want to go to the dentist and thought, what's the point, I can do this myself. 01782 208 008 is the number to ring. Big fan of DIY, but I draw the line at dentistry.
Yeah.
01782.